Coronaviruses are a group of viruses that cause disease in animals and humans. In humans, they usually cause respiratory tract infections ranging from mild ones, such as a common cold, to more lethal ones, like the 2003 Severe Acute Respiratory Syndrome or SARS. Studies indicate that COVID-19 first appeared in Wuhan, the capital of the Hubei province of China, in November 2019. Early hypotheses suggest that it spread from Wuhan's seafood wet market, where, apart from regular seafood, exotic animals are also sold for consumption. Since it first appeared, the virus has infected millions of people and claimed over 300,000 lives in more than 200 countries and territories. Prompted by the widespread infections, the World Health Organization declared COVID-19 as a pandemic on March 11th. Currently, most doctors and scientists agree that the novel coronavirus spreads through droplets that are released into the air when an infected person coughs or sneezes. These droplets may not remain airborne for long, but land on surfaces up to a few feet away and can infect through entering a healthy person's nose, mouth, and eyes. This is why wearing a mask, washing hands regularly, or using an alcohol-based sanitizer have become as crucial as social distancing. Good hygiene and social distancing, while necessary, are not enough. Aggressive testing, isolation of those who test positive and those they came in contact with, and treatment are necessary. Mainland Europe emerged as COVID-19's global epicenter in March 2020. But by the end of March, the US had surpassed China in the number of confirmed cases. Hospitals in the most advanced countries have run short of protective equipment, ventilator machines, and mortuary space as casualties rise. The pressure on medical systems has led administrations to try and flatten the curve, a term given to attempts to slow the spread of the virus in order for medical systems to be able to cope with the numbers. Without a clinically tested treatment protocol or vaccine, the spread of the pandemic has seen country after country lock down cities and shut down airports, bringing livelihoods, businesses, and travel to a grinding halt. Industries such as tourism, hospitality, manufacturing, retail, and travel have suffered lasting shocks. The virus also has a long-term human impact. People are afraid of losing jobs and the subsequent financial troubles. Even if one is not physically sick or infected, the pandemic has impacted mental health and well-being severely. Governments have responded differently. Some have offered stimulus packages for individuals and for businesses. Others have focused relief packages for vulnerable sections of society, like women, children, and migrant workers. As the global community grapples with the very real threat of an aggressive pandemic, it is evident the battle is far from over. Governments have to ensure that their citizens are taken care of in the post-COVID-19 world through stimulus and relief packages, increased investment in technology and healthcare, with special care being taken to ensure that non-COVID related treatments are not neglected. Public health today is the most important global security challenge and has placed human safety at the center of all strategic calculus. This must remain so even after the race to a vaccine is won.